Do you know that one part of your face can become paralyzed during pregnancy or after childbirth? Yes, and it is called Bell's palsy. It is a rare condition that can happen to 45 women out of every 100,000 women that get pregnant or during postpartum. This can happen to a normal individual. And of recent, Angela also has gone down with this condition. After she gave birth, she started wearing face masks saying that she had allergy. Sincerely, I thought it was just a rheumatic swelling somewhere around her mouth. I never knew it was Bell's palsy. And this is what pushed me into making this video, because Bell's palsy associated to pregnancy or postpartum is not talked about at all, and it is something that we need to be talking about to enlighten people, just in case anyone finds herself in it, so that the person will be able to recognize what it is and also know that it is not a spiritual problem. Bell's palsy is simply a condition where the nerves of one side of the face becomes weakened, so both the eyebrows, the eye, and the lips drops. This condition does not have a root cause, but there are risk factors that has been associated to it. The risk factors are divided into three, which is hormonal changes in pregnancy. Of course, we know that pregnancy comes with a lot of hormonal changes, and this makes a woman get prone to Bell's palsy. Secondly, we have the immunity level. When a woman gets pregnant, her body system fights for her own body and fights for the fetus inside of her. So this is somewhat an overload to her immunity, which weakens it to an extent. And this is a risk factor for Bell's palsy. And lastly, increased blood clotting, which is also something that is very paramount in pregnancy. It reduces blood circulation, which gives rise to the weakening of the nerves in that area of the face. Talking about the treatment, we have three broad treatment regimens. The first one is medications, which are corticosteroids, steroids, and antiviral medications. Secondly is lifestyle, which is where the chewing of the gum comes in, the patches and all of that. Thirdly is therapy. This is where the physiotherapists come in, the gentle massages and all of that. All this put together is going to initiate recovery. Complete recovery can occur, although in pregnant women, the recovery can be really slow. Don't forget that this can happen to anyone in pregnancy or postpartum, although there's been a special association identified in a woman who has preeclampsia. If you've watched up to this point, you owe it to yourself and to society to help one pregnant woman or two get enlightened about this topic.